Everybody, good morning. Good morning, one, good morning, all, and a hugely warm welcome. Ambassador, ladies, gentlemen, honoured guests, colleagues and friends from around the world, welcome to the second day, the second and for this year, final day of 2030 Insight Live. Welcome back. Now, the wonderful thing about spending quality time with people from around the world is a sea of faces become familiar faces, become new colleagues, become new connections. So thank you for forging those connections throughout yesterday. Somebody said to me in a coffee break yesterday, they said, I'm going to confess this to you. They said, Ollie, where do you get your energy? And the answer didn't involve caffeine or anything else, but I gave them a very honest answer. And it's, I get my energy from other people. And looking around this room, when you spend quality time in a room with people on a mission, making a difference, it is completely infectious. So thank you for what you're doing, not just in the world, but also what you're bringing to this summit. It's hugely important, and I will carry it with me for as long as I live. So thank you for what you're doing. Also, we'll say some thank yous and renewed thanks. This will come up more than once, because I don't think this summit would be anywhere near as brilliant and successful if it wasn't for our hosts at SERI. So thank you again for having us. And we'll come back to that. Okay, so we've got so much to get through this morning. So to help me think about what's happened so far and to look ahead to our second day, please welcome to the stage the president of the IAPB, Caroline Casey. Welcome, Caroline. Good morning. Right, good morning. Gosh, there's a vision in lime. Here we come.
It's green, Irish.
It's very nice. Top of the morning to you, Caroline. How are you?
Top of the morning to you. How are we?
Yeah, very good, thank you. Caroline, start of day 2, but I want to look at the day and I want to reflect on yesterday. Top takeaways, what were you thinking?
Well, top takeaways, a bit of wardrobe gate happened. I think a few people were cold, so that's why I'm wearing a very, it's like a cardigan or an anorak suit. So I'm definitely in the heat today. But the most important top takeaway really was, I think, as you said yourself, here, series hosting. Yep. And I think all of us, that last night's session, our drink session and eating, there was something really special in that room. Yeah. And I cannot underestimate what that energy it brings. Yeah. So I think that's the first thing. I honestly could say, aside from looking like a disco ball, the most important part of darkness is it does make light more precious and more glorious. And I have to say, I don't think that maybe you in this sector, no matter how you come into it, realize what's happening. Because for those of us who are not or have not been in this sector for many decades, what you're doing, the way that you're coming into this room in such a way to collaborate and to find commonality, I don't think you know how unique you are. I don't know if you realize, for those of us who are not in your sector, to see that genuine desire to find commonality, even with different perspectives, it's extraordinary. Yeah. Are you seeing that? Because I am.
100%. And alongside that deep expertise, that desire to connect with other sectors, globally, with our peers, but to take it way beyond eye care was the resounding message from Ambassador Webson yesterday, to put this slap bang in the middle of development.
Yeah, and I think what it is just please don't forget that. If you were in other sectors, you'd see how far you have come, and that you're not only an example to how we could end avoidable cyclops, but I think you could be a blueprint, this sector, to how real collaboration happens. So that is my other big takeaway. But the last one is the sense of joy and fun that is here, that underpins everything, because we come in here as human beings. And as Ambassador Webson so wonderfully opened yesterday, this is not just about our eyes and eye health. It is about every single one of us being the very best human being we can be. And I feel that that joy was,
Yeah.
it was infectious,
I
wasn't it? It really, really
totally
was.
agree with that. We've got lots to pack in today, Caroline. Something you're looking forward to, either about our schedule or overall about our remaining time together?
Well, I'm definitely looking forward to this session this morning, which is kind of the segue into it. I think those of you who know me know how passionately I believe in bringing the private sector or the world of work into any of the big social and economic and development issues of our time. Yeah. I've done that through disability with the Valuable 500. Now, today's session is something, I think this is why the room is packed as it is, Ollie, is because this is looking at the world of work and the private sector, not only as philanthropists or giving the money, but as a way for us to actually catalyze our ambition through getting screening of our employees around their eye health. Looking at the distribution of glasses and eye services, how can we actually do that? But to what Ambassador Webson said yesterday again, let's look at the productivity of our human beings in work, not just for work, but for the individual themselves. So that's what I am really looking forward to. And of course, the campaign. The campaign. Yes. I'm definitely looking forward to the campaign.
No, I feel a bit underdressed.
I'm wearing a clean t-shirt. Okay. It's definitely clean. So they're my two ones I'm definitely for.
So you're right.
No, the WHO and specs.
On the specs session. Okay.
Yeah, so my top three.
So WHO colleagues will be sharing on the specs initiative. The Love Your Eyes campaign will be put in focus, particularly with some global examples. And yes, we'll be deep diving into the world of work and bringing eye health sort of to the fore of lots and lots of employers around the world. But first, we sort of start with the big picture in mind. So Caroline, tell us who we're about to meet.
Okay, I'm very excited for having Ambassador Webson, who I know is a hero to many of us. Yesterday opening was incredible. And it's hard to even imagine who we could have to open today. But we are really delighted. And as we were planning this with the amazing IAPB team, when this woman said that she was come to open our second day, we were absolutely thrilled. It's Dr. Jamila Mahood. Now, you have seen and you can read her bio, but just can I say, one of the things Jamila said as she came in, I'm not an ophthalmologist, yet having decades of experience in health setting around crisis and disaster. But also, I think what makes you such a perfect opening for today is your leadership across multiple disciplines, where you've brought the experience of health and you sit on many corporate boards, your passion for sustainability and the environment. And can I just say, from the 2 minutes we've had with you, you're also beautiful, big heart. So can we please bring a wonderful round of applause to Dr. Jamila Mahood to open up our second day.
Thank you very much, Caroline, for that very, very warm welcome. What a pleasure it is to be here today. I'm a bit gobsmacked because you would have seen some interactions in the front. In 2014, I think December 2014, I had arrived in New York to take on a new job in the UN. And I went to a really formal function with the Secretary General there and a lot of ambassadors. And I fished out my business card and gave it to a wonderful gentleman. And I said, I don't really carry business cards, but I hope you don't mind taking this. And he held it and read it without looking at the card. And he said, oh, hello, Jamila. And I thought, And I realized then, because my card was in Braille, I had given it to an ambassador who could use Braille. And I was telling the story to Ambassador Webson to realize it was him that I gave the card to in 2014. So it's so wonderful to see you again, Ambassador, and I will never forget our interaction because I made everyone in my team have Braille cards after that, and I continue to do so until today. So here we go. So it's an honor to stand before you today, to be part of the discussion that is often overlooked, but holds such importance in our day-to-day lives, including mine, which is our health, our eye health. So without beating around the bush, let me direct your attention to this picture. This was captured a couple of weeks ago in Quebec as Canada is experiencing the country's world's worst wildfire season. and with blazes that are 100 times bigger than that they have witnessed before. Of course, wildfires are not all that new to Canada, but the intensity is increasing, amplified by the ever drier weather across North America. So what? Canada is relatively sparsely populated, you might say, but as you've seen on television and in the news, the impacts were felt in frightening and very far-reaching ways. 800 kilometers away from Quebec, this is the wildfire's effect on New York. And I used to walk around the streets here, and this loud, bustling city, everything is intensified in New York, the sights, the smells, the sounds. But I have never seen a sight like this, and neither had New Yorkers who are currently living there, who only semi-joke about how stepping out into the city's wildfire-tinted haze feels like stepping into a sepia Wes Anderson photograph, like a movie scene. But the short and long-term impact of this is most certainly not a joke. Air pollution in New York is not exactly new, but between 5th to 7th of June, levels of fine particulate matter, PM2.5, quadrupled, highest that the city has ever experienced. PM2.5 carries toxic components and is known to induce cell death in many ways. The average level that is considered safe is 35 micrograms of PM2.5 particles per cubic meter of air. And guess what the average on June 7th was? 200 micrograms, nearly 6 times what is considered safe. The dangers of this particulate matter pollution extends far and wide. Reduced visibility is obvious, but increased incidence of eye diseases are common, as are more dry eye signs and symptoms. Higher risks to conjunctivitis and even increases in age-related eye diseases like glaucoma, cataracts, and macular degeneration, which I shouldn't be talking about because you know better than me, are the leading causes of vision impairment leading to blindness. Preliminary research is also finding links between high temperatures and low rainfall, both common phenomena as the climate changes, and with reported increases in trachoma infection. Top that off with rapid digitization, increasing screen time, especially for young people, and things are not looking very rosy. And let's not forget the link between climate change and diabetes, and consequent increased incidence of diabetic retinopathy through changes in heat levels, extreme weather events, and air pollution. And studies have shown how that with more air pollution comes higher insulin resistance and increased risk of developing diabetes. In fact, it is estimated that 1/5 of type 2 diabetes globally is attributable to the 2.5 pollution, PM2.5 pollution. And 21% of patients with type 2 diabetes have retinopathy at the time of first diagnosis, while others develop over time. Now, I'm sure I don't need to go into any further detail on this, as you have been hearing, and you yourselves many of you are health experts that can speak with far more authority than I can on these issues. But if you only take one thing away from what I said today, please let it be that the link between environmental factors and eye health is irrefutable. As a medical doctor myself, the impact of these small particulate matters, some less than 10 micrometers in diameter, is shocking. They can easily be inhaled deep into our lungs and possibly even our bloodstream, as new research suggests. Odd though it may sound, the COVID-19 pandemic is an unfortunate but perfect example of how nature bites back in the face of our collective greed and corrupt behavior. Our collective blind pursuit of economic growth and unsustainable levels of human development have come at a cost to the planet, but ultimately to us. We are very clearly seeing that massive environmental degradation to accommodate urbanization breeds social inequities, promotes economic migration, and increases vulnerable people's exposure to risk. High emissions of greenhouse gases and the fossil fuels we burn for our day-to-day lives contribute to global warming and climate change. These greenhouse gases trigger more extreme weather events. Reduction in our biodiversity brings us closer interactions between humans and wildlife, thus posing greater threats of zoonotic diseases like COVID-19. So what is at stake? What's at stake is our own health. About 70% of the diseases caused by pollution are non-communicable, or NCDs, a burden that is increasingly rising globally, demanding higher costs for our health systems. Meanwhile, our health systems themselves are not yet taking anywhere near the level of responsibility that they should to address collective responsibility for generating the mess that they are also being called upon to clear up. If the global healthcare industry were a country, it would be the 5th largest carbon emitter in the world, responsible for 4.4% of carbon emissions worldwide. 71% of these emissions come from supply chains through production, packaging, transport, and disposal of goods and services that healthcare purchases. These include pharmaceuticals, medical devices, and all the single-use plastic instruments and products that we often use and see in clinics and hospitals. And certainly in eye care and ophthalmology, there's a lot of single-use disposables. As I stand here today, let me plead with you to advocate for and work towards a decarbonization of healthcare. Emissions, plastic use, waste, all of these need to be tackled. The health sector has a big role to play in generating momentum for change in the broader health industry's purchasing power and supply chains, moving towards low-carbon energy sources and technologies, transitioning to clean, renewable energy, and catalyzing greater responsibility and accountability for better planetary health. Other sectors are far down the road on this. Why not health? We must remember that behind statistics and numbers are real people living in this unfolding and sometimes deadly reality. Every time I talk about planetary health or air pollution, I'm compelled to tell the story of a 9-year-old girl named Ella Kisidebra, whose mother has become a dear friend to me. Ella died in 2013 because of air pollution-related asthma. Ella and her family live just 25 meters from the South Circular Road in Lewisham in the UK, where levels of nitrogen dioxide air pollution from traffic constantly exceeded the legal limit. Her pre-existing asthma was horribly exacerbated by the toxic air she had no choice but to breathe. She had severe asthma attacks and was admitted to hospital almost 30 times in the last 2 years of her life. As a result of her first-hand experience of the impact of fossil fuel emissions on health, her mother, Rosamond, a former teacher, is now a frontline advocate to end fossil fuel subsidies, working against the industry giants that continue to generate the same air pollution that ended her daughter's life. My point is this: we now live in the age of the Anthropocene, where human beings, yes, us in this room, are the most powerful force shaping the future of the Earth, and in turn, by the choices we make or allow others to make on our behalf, are dramatically impacting our own individual and collective health. It is our activities, our inquisitiveness, our ability to innovate, our free will that have led to spectacular progress in human development. It's the same traits, unmatched with foresight, knowledge of consequences, and more recently by decisions to ignore all the signs that have led us to the global warming and climate change, that intensifies weather events, making it harder for us to overcome these new challenges. It is also our human actions that drive fossil fuel use, supporting our incessant need for material consumption, thus propping up social, political, and economic systems that are not sustainable, ultimately designed to fail, which promote inequity and compromise human health. So how does this affect how we work and the world we know it? Globally, at least 2.2 billion people are living with vision impairment, and at least half of these cases could have been prevented or better addressed. Vision impairment has an economic impact, you all know, of productivity, which is great that we're going to be discussing this after this, costing the global economy $411 billion per year. With gaps in our healthcare system and ongoing socioeconomic inequities, we see 80% of people living with vision loss coming from low and middle-income countries, where resources and funding for quality healthcare are constrained. As levels of air pollution increase, those working outdoors and in manual labor will be the most affected, further stretching pre-existing inequalities. We also know that 75% of the determinants of health are social, environmental, and behavioral, and its attainment of good health are linked across many of the Sustainable Development Goals, including poverty reduction, economic productivity, and narrowing the inequality gap. We are now only 7 years away from 2030, and we are still very far behind where we should be, and highly unlikely to see our targets reached by 2030. Not to mention the systemic trade-offs that we failed to foresee in our designing of the goals. For example, in aggressively pursuing for economic growth, in GDP terms, we have further violated our planet's natural boundaries, worsening the climate crisis. So, what next for a world where the great threat of global warming and worsening climate crisis envelops all areas in our lives? And this is why I'm an advocate for planetary health and set up a center just under 2 years ago. Because it recognizes the interdependencies between health of the planet and health of the people and all living things on it. I'm proud to share that Malaysia has just released a health white paper that puts forward a strong reform of the health system, where the effects of rapid urbanization on planetary health are explicitly recognized. And I want to acknowledge the presence of our Deputy Director General, Dr. Fariza here, who will be helping us push this through. This has been a very long personal journey for me in painstakingly working to support the country's shift of Ministry of Health as a primary role of the health service provider, but also to increase its focus acting as a facilitator of a collaborative and multi-systems approach to health beyond just the medical care industry, out into the community, to the various sectors of society that play a role in the health of our nation and all people and living organisms that we live in. The white paper also stresses a great focus on public-private partnership. Now, getting the white paper implemented is going to be a huge challenge, but my sense is we have little choice. We have this window of opportunity to do so essentially or be done with as a species. My question now to all of you, the brilliant and committed minds that are gathered here today, and pardon the pun, but what is your vision for health, and specifically eye health, in the age of the Anthropocene? Here's how I see the vision, how the vision could play out. Firstly, we need to embrace the interconnectedness of human health with that of the planet. In essence, to embrace planetary health. When it comes to environment, a good measure of the planet's health are the planetary boundaries identified by the Stockholm Resilience Center. Basically, a group of scientists came together and said, what are the safe limits for humanity to thrive or even survive? And came up with these planetary boundaries. There's a very new set of boundaries now called the safe and just boundaries, which is also talking about justice. If you have time, please take a look at Netflix documentary called Breaking Boundaries, which really beautifully explains this with the wonderful Sir David Attenborough and Johan Rockström himself. When these quantifiable biophysical limits are violated, the sustained existence of life on Earth becomes less certain. The most recent assessment of the planetary boundaries revealed that 6 out of 9 identified boundaries, most recently the boundary for novel entities, including plastic, have already been breached. Violation of each of these boundaries have massive impacts on health, from respiratory illnesses and other diseases. Secondly, in the same spirit of interconnectedness, the need to work differently and collaboratively with a diverse range of stakeholders has never been more crucial, as exemplified by my sharing of the Health White Paper. Health is not just the remit of the Ministry of Health or the clinics or hospitals or the healthcare industry writ large, but by every single individual. We each have a role to play as community leaders or industry leaders and health advocates, as we know ourselves from the experience of the COVID-19 pandemic, how, when health is compromised, all areas of our life collapse. I remember my last conversation with Rosamond, Ella's mom, just a couple of months ago in London, and she said to me, Jamila, healthcare workers are the most trusted people on the planet. We trust nurses, we trust doctors, we trust every kind of healthcare worker. Why are you all not raising your voices on the fact that this planet is about to implode and there's a lot of health issues that will follow? I think it's because our health system and our health education has not been designed to suit the 21st century and the challenges that we face. As a younger medical student way back in the 80s, I was never taught about climate and health. And I go back to universities now, I'm based in a university, and I talk to the medical faculties and the curricula that they're having, it's still not there. Only the Canadians now have come together to look at how they want to change education, particularly in health education. Finally, I will pose the same question that I had asked you earlier and hope that it could guide your discussions, not just through the course of these 2 days, but when you leave to think about what is the vision of health in the age of Anthropocene? What are we waiting for before we finally acknowledge that we are in fact already extremely late to act against these rising and accelerating global challenges and to come together to initiate effective change for the future of the planet and humanity? I'd be very happy to remain connected with all of you. Just as we want to love our eyes, we have to love much more than that, the planet and everything else on it. Thank you very much, everyone.
Thank you, Jamila. Please stay with us. Have a seat. Yes, I can see. Thank you. Honoured guests, wasn't that absolutely fascinating? Can we have another round of applause for Jamila? Thank you very much indeed. Jamila, you're hinting there at that idea of a redesign in terms of healthcare, and one place that took you was to education. You pointed towards Canada. Whilst we're rethinking, any other reflections on how we might redesign, given we have this moment to think differently?
I think it's not just education. I think generally, there's a big disconnect between science and policy and action. We know this. We saw this, even with the pandemic. The evidence is so clear, the value of vaccines, how do you manage the COVID pandemic and so forth. So for me, there are 3 underlying factors we need to really pay attention to. One is looking at governance. Without the right governance, without the right political will, without the right systems in place, and really taking a multi-systems approach, this is not going to move things forward. The second area is communications. There's scientists, doctors, health professionals, researchers, where wonderful research papers are being done, but I often ask themselves, so what is the impact of that on someone's life? Often it sits on a shelf somewhere, or you get your brownie points and your scores go up. But what we need to do is, can we make research much more translatable? I think there is a lot now being done. Certainly the academic sector should wake up and do more. And how do you actually bring evidence to action? And it requires us to rethink how we communicate in an age where people get information from their handphones. So I think we've got to learn from young people and reverse engineer the communications bit on science. Yeah. And there's a lot being done right now on this. The third area I call education revolution. I often say this, as a doctor, we know that, embryologically speaking, the heart beats first, and then the neural cord develops, the brain develops. And yet when the child is born, the parents spend so much time on the brain and not too much on the heart. And when you lose your value systems, looking at what really is important, what is important to communities? We all, evolved from communities where success was about the success and health of the community, about the interdependence on each other. But now we've become very individual. So the education revolution I'm talking about is not just for the healthcare sector. Let me give you an example what I'm doing in Sunway University. So I set up the center in August 2021. So it's barely 2 years old. But what we've managed to do is we developed a module. Now in Malaysia, if you're in a university, you need to do something called the general studies sort of module, and you're allowed to pick 2 on different subjects. But in a private university, you need to do 4. So we have one now that's called Planetary Health for Community Service, and we're piloting it. And from 2024, every student that registers into the university will have to complete a 7-week mandatory course, otherwise they can't graduate. So in that course, 3 weeks is spent on the science of planetary health, and 4 weeks is application to community. So whether you're a culinary arts student, or a medical student, or an engineer, or a communication student, you will need to use that knowledge and apply it through your own discipline to communities. And what we're doing now is to take one community that's very marginalized, very poor, every single socioeconomic problem is in that community, and have a long-term view and measure the impact on what the students will design for them. So designing it with communities. So that's a kind of education revolution.
I think the trouble is I could listen to you all day, actually. I think this is our challenge. We should do a separate hour-long podcast or something with some of our other hosts. I want to introduce some other guests to the stage, but I really do have a very personal question, which is, you are at a stage now where the phone rings, where you're approached for opportunity, and I just wanted to wind the clock back a little bit to understand the origins of a change maker, and whether there was ever a time when you said, I need to be over there, I need to go and do that.
There are many stories, Oli, but let me tell you why I set up the Planetary Health Center, because that's more recent. By training, I'm an obstetrician and gynecologist, so so why am I in a humanitarian sector, so to speak, for more than 20 years? I was out in many crises in the world, from war zones to disasters, and I remember in 2000, I was watching the television. It was early in my humanitarian career, and there was a terrible flood in Mozambique. The Limpopo River had overflown. There were crocodiles in the water. And there was this image of a woman who was hanging on to a mango tree with one arm and who had delivered her child with the other hand. And I was thinking to myself, as an obstetrician, what kind of acrobatics was required to actually do that, right? It was so hard, even with both hands, holding on to something. And, so that image stayed with me. And then in 2019, just before the pandemic, I was back in Mozambique, again after a flood. I was playing with kids and talking to them about health, and then I was recalling this incident, to one of the nurses there, and she looked at me and she smiled, oh, that little boy, his mother just gave birth on a tree, in the flood. And I looked and I said to myself, 20 years down the line, and I'm still seeing this. Yes, the social inequities have not improved. climate change is worsening. I can't do this anymore. We need to go into the underlying drivers of why, we are in this state today. And that's when, I decided to set up the Planetary Health Center.
Yeah. Well, thank you for making that decision as well. Yeah. Thank you, Jamila. Well, thank you. Well, please stay with us because we're going to keep the discussion growing and expanding to include much more about the world of work. So why don't we welcome to the stage somebody who knows an awful lot about Singapore. Why don't we welcome up Dr. Shen Lei, who's the Chief Executive of the American Chamber of Commerce here in Singapore. Come up. Yeah. Shen, welcome to the stage. Yes, good. You've obviously got the energy vibe. This is good.
It's such an honor to sit next to you, Dr. Jamila. I actually wish I could just sit back down, like you said, Ollie, and listen to you some more.
Well, thank you for being here. Shen, just remind us, this is part of a global organization, but tell us a little bit about who is part of the Chamber and the sort of businesses that you work with and represent as well. We'd love a flavor of that.
Good morning, everyone. Thank you for having me here. It's a wonderful opportunity for me as a trained epidemiologist to come and talk about the three things that intersect for me at the American Chamber of Commerce in Singapore. And that is business, kind of obvious, with policy, that is what a Chamber of Commerce does, which is to advocate on behalf of our members, which does include nonprofits, by the way, not just corporate members. And the third one, which I have pushed very hard to bring into the Chamber since I joined in 2020 as the CEO, is science. And it may be a little self-serving since I am an epidemiologist, but I really felt that business and policy could not do what it needs to do without being more aware of the science contributions to what we do every day. And for me in healthcare for my entire career, that's pretty obvious. But for a lot of people going about their everyday in the different functions, they don't really realize that science is there. So what I do is push the value of science, the credibility of science, whether it's health, whether it's climate change, whether it's AI, into the consciousness of the companies that belong to the Chamber, which range from the biggest multinationals to some small and medium-sized enterprises, which actually for them is the hardest, because every day they are going out there to win the next client, to survive day to day. So for them, I think we need to provide even more support along this front.
Yeah, and to someone in the room who says, well, the challenge with some of these large companies is they have their own self-interests at heart. They're not tuned in to the biggest social challenges facing our society. What do you say if there was a guest with that going through their mind? What do you see firsthand?
Well, what I would say to those who might think that multinationals just think about themselves and the profit margin and the shareholders is, come hang out with me more.
Yeah.
I'm just down over at Orchard Road because I want to show you that multinationals, and we have a couple of friends who will join the panel later, really have the interests of their employees and the climate and the world in mind. And some of it is enforced. We've all heard of ESG. Of Those are metrics by which companies now must consider and report on every year. And so those will help them understand what is important. But on the other hand, think about how many people actually work at multinationals and how important it is for employers to think about their employees' health. A few weeks ago, we had the Singapore Minister for Health, Minister Ong Ye Kung, with us at the Chamber for a healthcare conference. And amongst his many messages, which does include Healthier SG, those of you in the room would have heard about this focus on preventive healthcare, bringing the family physicians into individuals, helping them understand the role of the GP. The other message he had was employers must take care of their employees.
Right.
Employers must think of that.
So on that, a chief people officer or chief exec might say, look, I've got a lot of aspects of my employees' lives to think about. Give us your reality check on where you think eye health is right now in their priority list. And we don't mind you being blunt, or give us some good news.
Well, my purview is probably a bit limited, so pardon me if it's just a bit biased. On the whole, I did an informal survey with my friends across the many different organizations, and yes, the sample size is very small, so it's anecdotal. Most of them do not have a clear eye health policy in place. Most of them do have, because they're large companies, the ability for employees to claim reimbursement for some eye care, maybe some spectacles, limited to maybe once a year, things like that. You can use your flex dollars, that kind of stuff. But from my experience with employees, teams, is they don't have a lot of time to go and figure out what the eye care policy is in the organization. So I can give you a few $100s every year to go buy your spectacles, but you know what? I don't even have time to get my eyes checked, let alone use that money to get specs. So on the whole, folks are not talking about it. And so what's great is, because I now am a little bit more aware due to researching for this panel participation, is I now realize that we have to bring eye care, eye health closer to the employees.
Yeah, so on that, and we're going to have some brilliant examples of leadership in this field, but to what extent do you see your role, Shen, as saying, well, I listen to my members and whatever they want, I do, or could you see yourself as an influencer in this, as a campaigner? Can we recruit you, is what I'm asking?
I wonder, I probably have some members in the room right now, or those of you who've known me for a little while. I'm definitely, Caroline, a fire starter. Yeah. So a little bit of controlled burn. I'm not just gonna let things, set on fire, but I definitely think the role of a chamber is to help bring knowledge to our members, hence the business, policy, and science.
Yeah, and
so we are all in on helping our members understand what is important, not just to their business growth and success, but also to their employees, because they're the critical component to success.
Right. Okay, so we'll absolutely build on that. Thank you. Jamila, help us think about collaboration between disciplines, between sectors. What have you learned?
In all my interactions, in the humanitarian field, but also now in planetary health, a lot of, as a medical person, we know the medical science and all that, right? We know what's needed. But the business sector, for example, has very different perspectives and the innovation space is also very large in the private sector. So what we've done is really, brought the different sectors together: the business, the policymakers, the governments, the humanitarian organizations in the past, civil society. And then what you do is put the problem in the center of the room, and then for a moment forget where you came from, but how do you collectively now look at solving the problems? You'll be surprised what solutions can come out, right? Let me give you one very nice example. When I worked in the humanitarian sector, a lot of the assistance you see is generally people sending food and all sorts of things. So we never really sit down to pause to think, what do people really want? Yeah. And how do you, in providing assistance, isn't dignity the most important thing? When you've lost everything, isn't dignity the most important? And that triggered really the whole shift, particularly in the UN, the Red Cross, all the organizations that I worked at, to cash as a way of programming. Now, we wouldn't be able to do this without talking to MasterCard, and others, right? To looking at how do you manage data, how do you empower people, unbankable people, to now be bankable through an ATM card? How do you, make women not have to stand in line to receive something, rather to be assured that at the end of each month, her ATM card will be loaded with some money? And I must tell you one story, if you don't mind. And one such person was someone we followed I'm trying to think which island it was in the Caribbean, and I've forgotten, after a cyclone. And we watched what she was buying, and she actually bought a pair of earrings. And, I looked at it and I said, in humanitarian assistance, but she's buying a pair of earrings. And, so we approached her and said, so you bought a pair of earrings, it's very interesting. Why did you choose that? And she said, it's Christmas next week. I have to give something that my child will look forward to. So I think we always assume that it's just the food and stuff like that. But people want to have joy in their lives, right? And some sense of normalcy. Yeah.
No, well, thank you. Well, I suppose our wider theme now, as we sort of look out across the world of work, is to look at what is already working. So I'm going to introduce some guests to say what they've done and hopefully be very candid with us about the challenges they might have faced as well. One guest who wasn't able to travel with us to Singapore, but who I know wanted to share their well wishes, will be known to some of our guests here, Joaquim Nunes. He is the Chief of the Labour Administration in the Labour Inspection and Occupational Safety and Health branch. His business card must be massive, of the Governance and Tripartite Department of the International Labour Organization. So at the ILO, Joaquim has sent us this message and we're very grateful for it. Let's have a look. We'll see if we can get that message from Joaquim a little bit later, because it would be important to see it. So this year's theme, if you like, for the Love Your Eyes campaign is Love Your Eyes at Work. You may know this already. So it's really about prioritizing eye health within the world of work across different sectors. So we're going to ask you to stay with us, please, but then maybe to just get us thinking about this, Jamila, why is it important for us to think about the workplace in public health? Just remind us the crux of that.
Well, I think that, we looked at inequities. I spoke about inequities, about how, we need to look at sustainability. But at the end of the day, how productive can people be, right? And especially today, a lot of work can be done remotely. You do need to use a lot of screen time, so the eye health is extremely important. But I think generally, the whole way we look at work today has got to shift. Yeah. We have to rethink what kind of work do we actually want to do? How do we move towards what we call more green businesses? And I think a lot of the nature-based solutions that are now being looked at in industries have actually led to growth of many businesses. Yeah. So being sustainable is also very, very good business.
Right. So why don't we build on that briefly, Shane? When you're speaking to employers, to what extent do they see this as part of looking after their people? And to what extent are they exploring the really tangible business benefits?
I think that awareness really accelerated during the COVID pandemic. It's amazing that the conversation around mental health has become so prominent, where definitely in Asia, we did not like to talk about mental health. And still, some of the statistics around suicide attempts are still very much kept undercover. But we know those numbers are increasing. If we take the lead, understanding how our approach to mental health has changed, I think eye health is an even more palatable conversation, and I would dare to say easier one, because many of us are affected from young. Our children, we're very mindful of their eye care. So in some ways, we might not have such a difficult haul, but then comes the price tag. So the question is, what kind of investment are we willing to put in?
Yes.
If you take some of the budget that's been allocated to mental health, and I don't want to take from one pocket for the next pocket, that kind of thing, it doesn't work. But I think the investment to mental health has suggested that companies recognize that employee well-being, which includes physical health as well as mental health, is worth the investment, because it does benefit the bottom line, and it creates a more loyal workforce. Yes. And it may actually reduce liability as well, because if you think about the causes of some of the eye diseases, I don't want to give anybody any ideas, but I think some of what we're doing at work could be contributory factors to the kind of eye conditions that we're currently seeing.
Well, we'll hear firsthand about those different motivations as well, which we're looking forward to. Good news, I think we can see that video from our colleague Joaquim at the ILO. Let's have a look at their message.
Dear ladies and gentlemen, good vision is essential for almost every aspect of our daily lives. From walking to driving, communication to education, and of course to working. good vision enables us to live full and productive lives. At the International Labour Organization, we understand the importance of protecting workers' health and safety, including their eye health. Since its founding in 1919, one of the core objectives of the ILO has been to promote safe and healthy working environments globally. We have developed over 40 international labor standards focused on occupational safety and health, which establish minimum requirements for managing and controlling work-related risks across a wide range of occupations and work environments. Recognizing the significance of a safe and healthy working environment, in June last year, the International Labour Conference, which brings together governments, employers, and workers' organizations from 187 member states, decided to amend the International Labour Organization's Declaration on Fundamental Principles and Rights at Work to include a safe and healthy working environment as a new fundamental principle and right at work. This amendment underscores our commitment to protecting workers' health and safety and promoting a collaborative tripartite approach to maintaining a healthy workplace. This landmark decision also designated the Occupational Safety and Health Convention No. 155 and the Promotional Framework for Occupational Safety and Health Convention No. 187 as fundamental conventions. Now, all members of the ILO, regardless of their ratification status of these fundamental conventions, have an obligation to respect, to promote, and to realize in good faith the principles concerning the fundamental right to a safe and healthy working environment. Despite all these efforts, however, data available indicates that about 13 million people in the working age population globally lives with vision impairment of occupational origin. This places work-related vision impairments as the third largest causal factor of vision-related conditions. Motivated by these findings, we developed a brief in collaboration with the International Agency for the Prevention of Blindness, which aims to raise awareness about the burden of sight loss within the workplace and provide recommendations to governments, to employers, to workers and their representatives for identifying and eliminating workplace risks that can impact the health of the eyes. By prioritizing eye health awareness and implementing effective interventions, we can ensure that workers have access to a safe and healthy working environment, protecting their health and well-being while also increasing productivity and reducing inequalities. We all have the right to health in all its physical and mental dimensions. We all have the right to a safe and healthy working environment. I wish you a very successful conference. Thank you.
Thank you, Joachim. Thank you for that message. Well, why don't we welcome up Anshu, Carlin, and Sami to the stage. I'll introduce them formally as they come up, but give them a round of applause as they join us. Thank you, everybody. Please come, Sami, have a seat. Welcome, please have a seat. Hello, Carlin. Hello, Anshu. So we're going to go quite rapid fire to look at what 3 organizations are doing to join these dots and hear how it works in practice. Anshu, do you mind? Well, let me just tell you. Anshu Taneja is the country director for India for Vision Spring. Welcome. Next to Anshu is Carlin Tan, the vice president for regional benefits at Nomura. Welcome. Thank you very much indeed for joining us. And at the end, Sami Ho is the Director of Social Impact and Sustainability at Williams Sonoma. Let's give them a welcome. Thank you very much indeed. So I suppose, Anshu, what we're very hungry for this morning is real examples of integrating eye health into businesses and workplaces. So please, the floor is yours to take us through what you've seen.
Yeah. So thank you very much for having me here. Good morning, everyone. Vision Spring screens low-income people and provides glasses to them. Annually, we would be touching about 2 million people with glasses and screen many more in the process. So if you talk about people who really need vision and that's directly related to their work. We work with communities such as weavers and artisans, commercial drivers. We work with factory workers. We work with others who really, communities which really household women who are working and engaged in professions which require them to do sewing and other stuff to kind of earn their livelihoods. And we've seen remarkable and staggering results. We've seen about 65% of the people that we screen need clear vision and need glasses or some kind of an intervention to see clearly and do their work. And the problem is so huge that, and the awareness levels are extremely low, and so low that they would be working in a factory setting in an environment where they are kind of doing something which is directly earning their wage, but still then the awareness levels are very, very low. So, someone talked about Prime Minister Modi's constituency yesterday. We screened 100,000 weavers there. We found that 70% of them needed a pair of eyeglasses to see clearly. 80% of them were first-time wearers. So if we hadn't gone and approached them, they would not have been able to, ever have a pair of glasses. So in that context, what we need to do is we need to get different stakeholders together. We need to push it beyond the eye care sector. Unfortunately, in this room, I see a lot of eye care people, not in the panel so much, which is great, but we need to engage other sectors, bring them, widen our horizons, because it's, it starts as a health issue, but it's a catalytic input into so many other things like road safety, like earning potential, livelihoods, skilling. And many of the governments around the world are working on these themes. Yeah.
So just give us an example. When you're working with an employer, does that then become an ongoing engagement? Are you educating them? I'm trying to understand the nature and duration of the relationship.
Yeah. So it does become an ongoing engagement. We start with creating awareness, screening, providing a pair of glasses. We, in most cases, try to place a vision champion and employ from the HR on the administrative team within the factory or that community who could serve at least in terms of reading glasses and guide them for distance vision glasses or refer them to hospitals if they see, which is something beyond refractive error. The idea is to create awareness, generate demand, because for too long, the work that we're doing is more about pushing it, and we need to have that pull from the community.
Got it. So on that then, just to be totally clear, you're being paid Vision Spring by the company to deliver these services?
It depends, the various models. Sometimes it's directly the users of glasses.
Oh, I see, the end user.
They would contribute. At times there is the organizations contributing, and at times there is a third donor that is contributing for this intervention.
Yes.
So there are different models, and sometimes it's a hybrid. It's kind of all getting together, and also lots of in-kind support at times.
Yeah. But when the company pays, which budget does it tend to come from?
Well, if the company pays, it comes from the HR budget, and that's one of the issues, because the CSR acts around the world do not allow, direct investment into employees. That's more about supply chain, but there should be a degree of separation there. But when it's direct, it comes from the HR budget, which I think needs to change.
Yes, to change to what?
Change to CSR acts being allowed for organizations to invest in their employees.
Okay, right. Let's pause there. Carlin, tell us what you've been doing and how it's been going.
Hi, good morning, everyone. So at Nomura, we actually recognize employee well-being as unique and multifaceted. So we aim to foster an environment to promote environments to actually promote employee well-being and allow them to actually grow. So what I do is that I design the employee well-being into 4 essential factors: physical, mental, social, and financial. With that, right, and in the initiative that I do recognize for these 4 pillars of well-being, and that's across Asia. I also restructures our employee medical benefits to be around these 4 well-being pillars, as well as industry standards. So this, in the recent surveys that we conducted internally with Mercer across Asia, that actually shows a good percentage of employees feel satisfied about their employee well-being, and definitely eye care is one of the physical well-being.
100% is, and it touches all 4 though, doesn't it? I suppose. So in terms of how you approach this, are there certain decisions you've made about what everyone gets, or is it very personalized? Like, I'm just trying to understand how you've approached it and what that means for your team members in practice.
Okay. So we try to do benefits to be applicable to everyone. So because especially for physical well-being, like eye care, everybody needs this eye care. I cannot say that, you're a contractor, you don't get this benefit. So that's where for HR and employer, so it's important that when we design benefits program, it's applicable to everyone. And we want to make this close to everyone. And that's what, like Shen Xian had mentioned, that on her doctor checks, people have flexible benefits. But do you focus on eye care? Most of it, you may do it like, let's claim for a gym membership or your medical care. So it's just like as our majority of our health screening, it's focused a lot on body checks, but there's very little inadequate on eye check. Okay, so that's what I do in bringing eye screening to part of our employee in-office health screening to make it convenient for everyone and it touches everyone.
And what's the uptake been like?
Well, the uptake was very good. So we have very positive feedback, and we have more than actually about 70%, and that is actually during COVID time, where in-office working is still quite prevalent.
Yeah.
So we have more than 70% people take up for the on-site health screening that encompass eye checks. So our eye checks that I do is much more, is go beyond the visual acuity. So we check on tonometry as well as retina imaging.
Yes. Okay. No, interesting. Thank you, Carlin. Sammy, tell us about your story and what you've done in the company.
Yeah, sure. So we have been partnering with Vision Spring since 2016. And through Vision Spring, our factory worker will have access to free eye screening and also glasses, and it's paid by us. So our factory employer and workers do not have to pay for them. And so far, we have screened 30,000 factory workers so far in Asia. And then the refraction error rate is about 49%. So meaning nearly half of the workers we screen have needed and have been given glasses through our partnership with Vision Spring. And this is like a huge change for workers, because the average age of our workers is about 40 years old. And 74% of them wear glasses for the very first time. So they are already halfway through the life, but it's the first time they have a good vision. And through the impact assessment of Vision Spring, so 79% of the workers reported less frustration at work, and 29% reported less headache and fatigue at work. And also our factory employer reported a drop of 63% of product defect. So there's a huge win-win situation.
Sammy, say that last stat again, because I don't want to miss it.
63% drop in product defect. They check the quality of the product, so there's an improvement in production quality.
Yeah, really helpful. Okay, and forgive me, my fault. I should have explained, because Williams-Sonoma is kitchen utensils to just the
and
type
furnishing,
of company.
Home furnishing.
Yeah, everything. Yeah, exactly.
Yes.
Okay. Dangerous because you spend too much money there. Yeah, I see. Okay. So perhaps for Carlin and Sammy, you bump into a very skeptical finance director who's not yet had their coffee, and they say, it's all very well, but how's it making us a stronger, more successful business? And they're not yet convinced. Sammy.
Actually, we have seen great numbers coming from this partnership, because many of our products have handcraft element. We have hand-woven, hand embroidery textile, we have handcrafted furniture. So it's require a lot of detail near work. So with the glasses, the worker actually able to do the work with more accuracy and also better efficiency. So it has proven that it improved their income earning ability.
Yeah, I mean, that sounds like a slam dunk to me. Carlin, what's your argument?
I wouldn't say getting approvals for budget is an easy journey, but it's a long journey that we need to continuously get it through. So what we actually do is that we actually showcase in terms of our employee well-being versus your retention rates. And that's where we actually conduct well-being survey. And that's important to show that your employee is satisfied, and that's where you get retention. So that will be a good conversation.
And what about the case that Sammy is putting, that this helps our teams to be better at their job as well? Evidence to support that?
Having an engaged employee that will make you increase your productivity.
So back to engagement. Okay, so let's broaden it out to involve everybody. Tips and advice about how eye health professionals can work in practice with employers. What have you learned? I mean, Jamila, just help us sort of to think about it. I mean, have you got a sort of overall reflection from what we've been hearing?
I think what you hear very clearly is that you need to engage, right? You need to see, as businesses, you want to make a profit at the end of the day, and you want to retain your employees, right? So engagement is going to be key. Engage on issues which are very personal to them, which is health. So, if I can come in from the sustainability angle, younger employers now are very, very much more aware about the importance of climate change and global warming and others, right? So, how do you take that a step further, right? Looking at recycling, for example, spectacles. How do they feel involved in sustainability? If I give you one example, I used to do a lot of work in remote villages in Malaysia, where they used to do a lot of beadwork and basket weaving. And a lot of them have visual impairment, and they don't have access to healthcare. But we work with, stores in Malaysia that have opticians, and so what we do is we get a program where people donate their old eyeglasses and stuff.
Yes.
So we can't bring heavy equipment in, so what we do is we bring some volunteers from their industry, but also using a needle and thread, right, and beads to see whether is this the right spectacles for them to at least continue doing their work. Low tech. Yeah. Everyone feels involved.
So should help us understand in practice, because we see it flourishing in partnership here with Vision Spring, but help us understand the reality check of some of the challenges that members might face, particularly forging what are two different communities together.
I think it's a very important question to connect, right, to communicate and all of that. And this, I'll just make a self-serving pitch. This is why chambers of commerce and trade associations exist, so that we can reach out to a larger group of stakeholders. And in this sense, I think I have been speaking to the team, Jude and Peter and Caroline, about possibly coming to our organizations as a starter to say, hey, 650 companies come to AmCham. Let's talk about eye health and the impact on the bottom line. Let's use our facilities as a screening place. The on-site screening doesn't just have to happen in an office location for one member company. How about reaching out to 650? So chambers of commerce, trade associations are great organizations to partner with.
Yeah, please build on this, Jamila.
Again, build on the communications. I want to tell you a story of how, I think as health professionals and healthcare workers, we have a lot of stories, right? We meet patients and we meet people. And I remember talking about sustainability and stuff, and talking about Ella's story, right? And to a very difficult polluting industry. And one of the most senior people in the room actually turned around and said, I've heard so many of these talks about climate change and global warming and how we're such polluters, but today it landed here. And so he's now become a real champion to try and see how they become less polluting, looking at new ideas, looking at collaboration. So I think we have a real advantage being healthcare workers. We have human stories to tell.
Yeah, absolutely. So Anshu, and forgive me giving these cynical, skeptical archetypes. I mean, there are some very visionary organizations, some of them here. But if a chief exec says, Anshu, I'm intrigued by the work you're doing, but I've only got a minute, So distill for us as a corporation why we should work together. You must have learned which messages work better than others.
Yeah, I think like with everything else, it's what's in it for them, right? We need to see their side of the story, how it can help their business, how it can help their reputation, how it can help, them expand their work.
Yeah. And on that, forgive me interrupting your flow, but on productivity, on retention, we've covered those. What have we not touched on? Reputation helps?
Yeah, so reputation, it helps on a lot of things, small things like defects that she talked about, that's something which is going to earn more money. Yeah. It's going to make the product much more better for the customers. We worked extensively in the tea gardens, for example. Yeah. So picking and sorting tea, we did some studies which says that, the productivity increase could be up to 32%. What it means is really the same amount of employees getting more tea, picking and sorting more tea, better quality of tea for the customers, and more income for the tea gardens.
Right, so let's pause here, because we're going to get some questions, some reflections from online, but also here in the room in Singapore. I suppose, Sammy, connecting some of those pillars that we were talking about and bringing mental health back into it, being able to see clearly has a relationship with confidence, how we feel about ourselves. So actually it's so much broader than eyesight at first glance.
Yeah, we actually have workers share their story about having new glasses. They're able to read religious texts, which they were not able to do that for a while because the text, the print is really small. And also we have workers who are mothers and say that they're able to do homework and read with the children after. These are not small improvement. Quality of life is very important. And there's another very important story shared by Vision Spring. We have actually, not our worker, but from our factory, a survivor of a car accident because not able to see clearly the traffic is like deadly. So imagine for our factory, the average age is 40 years old and 74% have glasses for the first time, and our program mostly in India and Vietnam, and people drive motorbike to work. So there's a huge improvement in their own personal safety as well.
Interesting, yeah. And having given our chief executives a hard time, I think if I told some employer friends that this would help their employees read their kids a bedtime story, they would probably sign up tomorrow. So I think that is very interesting. Questions, insights, what's not been said, what has really resonated? You can direct a question to all or to one of our panel, and if you raise your hand, we will come to you. I see you there, sir. Thank you very much. I'm looking around. Thank you very much. I'm looking for other offers, particularly if you've not shared. No, I'm very happy with both of those, but I want to get a sense of where we might go. Okay, I'm looking. Yeah, why don't we come just to this, Jude, if that's all right with your help. Thank you very much. Feel free to introduce yourself. Thank you. Good morning.
Good morning. Thank you very much indeed. Andy Kessels-Brown from the Fred Hollows Foundation, and I'm delighted that we've invited you to our Climate Action Working Group this afternoon, if you're able to join us, hopefully others as well. One of the themes of this meeting is kind of how can we get this collaboration going? And the topic of systems leadership has been discussed. I was just being introduced to this notion, and I kind of felt I understood what that might mean, but we have a session on systems leadership here within the program. Is this something, I'm asking Prof really, is this something that you've had an experience of in terms of climate change? And if so, how can this particular forum mobilize and marshal going forward on that? Thank you.
Great. Now, please, and that's to Professor Jamila, I think, on systems leadership. Please. Yeah, exactly. That's just what I was going to suggest. I think you're waiting kindly there for a question, sir. Am I right? Yes. Please, and then we'll go over to this side. I see you there as well, sir.
My question, I'm Chundak Tenzing from SEWA Foundation, and my question is, we all know that 80% of the blindness is curable. Still, we are struggling to reach that goal. Where did we go wrong? You have here, it says 2030 insight. So what are our insights?
Yeah, where did we go wrong and what are our insights? Great question. Let's take one other thought or question from the room. Very well made point.
Yeah, thank you very much. I'm Geoffrey Wablembo from Light for the World. Yeah, what I thought has not been said is a bit of investment in research regarding the people we are serving, because most of the spectacles come from some places, and we are serving people in completely different parts of the world. But when it comes to design, we need some small investment to see what is suitable for the different persons, different groups of people in different areas. Thank you.
Yeah. No, it's a really good point. Well, we will have time for a few more questions. We'll just keep one eye on our clock here. We've got about 10 more minutes. Yes, and I see the ambassador waiting. But what I thought, let's not miss those thoughts. I'll come to you, Jamila, on systems leadership. But, I mean, our guest makes a great point, don't they, Anshu, or others, on, where did we go wrong? And what are our insights? If any of you were to step up to those challenges, what would you say?
Yeah, I think, the problem is that there is lack of awareness. We need to build awareness. Once that awareness is built, demand is generated. It's like the classic toothbrush example. I'm talking in context of spectacles, but it could just be, about anything in eye care. So if we are building demand, if we're breaking social stigmas and taboos which still exist at the low income level for a lot of eye care interventions, if we make it affordable, we make it accessible.
Okay, this is helpful because yeah.
And this is how, a lot more people would adopt these. And then, it's a classic adoption curve. When it reaches a certain stage where people have it, then those who do not, then automatically people would ask for more eye care.
Right. So thank you. Other insights from guests, Shen, please.
Well, speaking as a former health communicator, but I have always thought of myself as a health communicator, it's communications that raises awareness, but it's also coming up with the impactful messaging. And it seems that the emotional stories, touching upon the emotions, is going to be critical for us to move this forward, because logically we know eyes are important. And the other thing I want to raise is there is going to be a huge difference to the third question around differences between groups, nations. The lower middle income countries definitely face a greater disease burden. We're sitting in Singapore, it's a developed country, and screening happens in schools, not always the best screening, I have to say. And yet we still have challenges with adults not getting checkups and all of that. So this communications piece needs to be customized, and we need to get our messaging right.
Yeah, 100%. Jamila, let's not miss the chance for you to respond on systems leadership.
That's such a great question, and I wish I could come this afternoon, but I actually head to the airport to the summer Davos in China after this. I think, first of all, today, people are not wired to be systems thinkers. It's just not the way we've been educated, right? And this is why we have a lot of problems, the siloed thinking. I think what you need is a very cleverly designed and facilitated discussion. If I can give a shout out to a very good organization in Singapore called Forum for the Future, run by a bunch of my friends, what it does is that you bring the different stakeholders in the room, and you need to talk about reimagined futures. You really got to think about, what does it look like? What does that shared vision look like? And what are the different scenarios that you're going to be facing in the world today? Don't plan for today. You need to be starting to plan for 20 years from now, 30 years from now, 50 years from now. And therefore, what systems need to be in place for you to start addressing the problems then?
Yes.
So that really is the essence of shifting towards a systems approach, which means that everyone will have to play a role. In actually trying to design, for something better than what exists today. And there are now, you need help. I think for good systems thinking, and you need some of these people who are futures foresight people who really can help, help you navigate through these discussions.
And imagine is such a powerful word within that context. Thank you. We would love to know, Ambassador Webson, thank you for being with us again today, sir. I'd love your reflections on this discussion and your own perspective, please.
Thank you very much, Ali, and what a wonderful session. And thank you to the panelists and the presenter, because they certainly have connected the dots. We were speaking yesterday a lot about linking the agencies. We ended up yesterday with speaking about the 2030, what would we have accomplished by then? that's the kind of thinking of reimagining the future. An ophthalmologist was sitting next to me on Saturday, one of the members of this group, and I'm at the dinner, and I said to her, 20 years from now, what would you like eye services to be like? And that's the reimagining the future. And one of the things we might want to do is get a group of people in this field and connecting the dots with other fields. We just heard from the Chamber of Commerce and so on, and reimagine the future. The 3 points that I wanted to just quickly mention. Research. I think it's so important in linking research in eye health and work. We've been speaking a lot about, you hear every day people speaking about, since the pandemic, we are all at the screen, we're at the screen, we're at the screen. What an opportunity for eye health to link that with work by doing research on what does the screen do, A, to children, and B, to the folks in the workplace, even those of us who have decided it's best to work from home. So I think that's one thing. Similarly, linking the Chamber of Commerce, is listening this morning, we know that there is significant linkage with the kind of work that the Chamber of Commerce can do with the eye health sector. I'm not sure how much we use the Chamber of Commerce as an agent within the advocacy on eye health, as it represents decent work for people and productivity within the workplace. And that coming from the Chamber of Commerce, from an eye health perspective, would be a really good linkage that we can make. So I think this morning is a good emphasis on linking the dots, and climate change, and the session on climate change also could begin to link how we see the effects of climate on eye health. In a broad sense, the last point would be the eye health sector measuring its carbon footprint through the use of plastic. And you know, we use plastics for everything. And is the eye health sector taking an examination of itself and looking at its footprint in this area? And those are the linkages that we're talking about in pulling the dots together.
Yeah. Thank you, Ambassador. Really helpful reflections. Thank you. Keen to get other voices in the room, and then I see a hand has gone up and you've been patient down the front there. Why don't we start here, Jude, and then we'll go back to that second back row. I'm looking around. Thank you, Jude. I see you, Brandon.
Thank you, and good morning, everyone. And it was a wonderful session, and particularly I'm intrigued by the work Dr. Jamila is doing. I think we, in our medical school, learned the relationship between agent, host, and environment. And somewhere down the line, I think we have lost connectivity of health to environment. And I'm really happy that we are bringing that. At LV Prasad Eye Institute, we have made a commitment that 70% of energy that we will be using will come from natural and solar system, and make our all the facilities working toward protecting the environment. So I'm very happy that in some way we are linking environment to
No, good. No, thank you. Kudos to you and your colleagues. Why don't we go, Jude, with your help, right up there. Feel free to introduce yourself. Thank you. No, well, especially for our online guests. Here we go. Russell's got some help. Here we are.
1, 2, 1, 2.
Thank you for highlighting storytelling and human element in communications. I love storytelling as a form of communication. And the two target audience or stakeholders that I feel are important are media and youth. I wanted to ask, are there any existing examples of involving media and youth, sensitizing them to be champions in taking forward eye care, motivating masses to seek care?
Great question. So while our panel think about that, I'll take any offers for a reply on that. Would you mind, Jude, with your help, we'll come down. I see our colleague Brandon from Fred Hollows on the second row. Thank you very much. Has anyone got an offer on that media or youth angle? Okay, okay, yeah, great. Thank you.
Good
Good
day,
morning.
Brendan from Fred Hollows. Thanks very much. It's been really interesting. But of course, eye health is for the 100%, not for the 90%. And there will always be about 10% of people who can't have their vision restored. So I'm interested to know from the panel, because the one thing I've not heard so far is anything in relation to support for people who are blind in relation to work. So for around accessibility, training, and technology and the like. So interested to get any thoughts from the panel.
No. Great question. Right. So on both of those questions, the first on media engaging young people in particular, any reflections, stories, points of light?
Not on eye care, but on the issues I work on. So we do two things. One is, we work a lot with young people, youth groups, but also students, civil society, where we actually not just do fun, the usual things that you do, young people, you take them on educating them on this and that and the other, but we actually give them solid work on looking at how do you look at policies. Because one of the areas that I think we need to step up is our analysis of policies among young people. They're so smart, right? They can get access information. And we teach them how to critique policies, to look at, if you were in a position of power, what kind of switches and what kind of shifts need to be done in policies. And we ran this, just to give you a story, we call it the Planetary Health Boot Camp. So we really give them information, knowledge, but also present to them. They can go into the web and look at any policy they want, whether it's health or anything like that, right? And it was open to university students, anyone. The winning group was a bunch of 16-year-old high school students. Who beat the PhD students and everything else, because the innocence of young people is that they can see through bullshit, right? Sorry, pardon the French. And they can really pinpoint where the areas are. That's one. The second is media, and this is such an important question. So I sit on a group in the World Economic Forum that's actually it's called Earth Decides, and it's about how do you translate science into communications. And right now, we're really playing around with cartoonists, with other, not the usual suspects media, because media will always go to what's the next sensational story.
Yes.
But how do you engage now in an age where people are actually consuming media differently?
Yes.
So my advice to you as a healthcare industry, the eye care industry, is that know your media landscape, where you're working, how are people consuming information, and use that. So we, for example, to talk about risk, even about risk of eye disease or whatever, right? So we've used things like not just cartoonists, also trapeze artists, because, so we've had trapeze artists flying around a room looking at risk, because, that's one of the most risky things, right? Not only will they fall, they might fall on you as well.
Yeah.
So how do you look at, risk of
Trapeze,
Yes.
well, I hadn't thought about this.
Yeah,
Okay.
yeah. So, and then bring the media into the room, because, they also want to be intrigued by things, and use art and music and other forms of communication that are often neglected.
Right, thank you, Jamila. Watch this space, 2024, trapezes, give our audience something to grab onto, I see.
I do have an example that just occurred to me. I don't know if my classmate, Professor Sa Xiang-mei, is in the room. I thought I saw her, but my eyesight's also not very good, so I was like, is she the person in the back? But Professor Sa Xiang-mei is a professor here in Singapore that many may know as a leader in the research of myopia in children. And Singapore in particular has a huge issue with myopia in children, and therefore, I think the media has been terrific in covering this issue, also highlighting various treatment options. Number one, prevention, which is get outside and get some sunlight into those eyes. Very hard sell in Singapore, because you know how darn hot it is. But if anyone's looking for a case study in how to partner with the media, partner with a government agency into promoting eye health, I think the myopia in children example in Singapore would be a good one.
Thank you, Shan. I don't want to, thank you, good example. Let us address Brandon's question on people with no eyesight at all. Who will speak to that? Thank you, Colin.
Hi, I'd like to share on a personal experience in my previous company where I have a team member who is visually impaired. He has only 20% of his visual. So I think creating a physical, safe environment is critical. but in terms of the mental and social environment is critical as well. So the team we have, and we actually take him as what we do. He do the typical same work as what we do. So the work quality and the workload is empowered with us by providing with an environment that he can work in confidence and independent. Yeah.
Yeah, okay. Anshu, anything to add on this?
Not really on this topic. I just could deviate a little bit and talk about, the climate part of it. An important point, imagine a truck driver driving without clear vision, taking more time to reach the destination, using more brakes, and inconsistent acceleration.
Yes.
So putting out more pollution in their environment.
Understood. No, it's
so
yeah.
Just wanted to put out that point, how directly it can be linked, climate health, the climate change and eye health.
Okay, thank you. So to be honest, can I switch it a little bit? Because I'm hungry for more on this, because I want the room to get more, with all respect and thanks to our panel. Brandon, can I bring it back down to you, if that's all right? Because I'd like a note from you, please, to our guests on what your message would be to employers to make sure that they are as inclusive, as welcoming, as supportive to people that you're describing and you represent as they ought to be.
Putting me on the spot, Ollie, thanks for that. I think all what you said so far around policies, around having initiatives around eye health screening, absolutely perfect. You can also have policies which enable training around assistive technologies or Braille or whatever it is to support your workers who may have needs for assistive devices. So in the same way, you may have a policy that enables screening and the provision of spectacles. You can also have provisions that enable referral through to those in the community who can provide training.
Yes.
And the provision of assistive technology as part of that package. So I don't see them as being as different packages, the same package. It just looks at the spectrum of care. And that's what we've been talking about for a number of years now, particularly with the integrated people-centered eye care across the spectrum of care, and also the Sustainable Development Goals. So again, my message is eye health is for the 100%, not just the 90%.
Yeah, fantastic. Thank you, Brendan. So let me, in closing, because we've been beaten by the clock as we race up to the top of the hour, but we're going to do a little bit of connecting in the room before that coffee break. I am going to throw you on the spot to say, if we're to see a step change in how employers and workplaces around the world embrace eye health, what one thing would need to happen? And Sammy, I'll apologize later, but I am going to come to you first. And you be as pithy or as blunt as you like, because these can be rallying calls, they can be advice, please.
I think to promote the culture of health in general is very important, because for our supply chain, we have a lot of compliance requirement, but actually it's also all those compliance requirements, safety requirement workers do not follow. They see the safety device, the safety goggle as inconvenience. Yes. Why would they think that when it's their own personal safety? So I think the general concept of health, the culture of health and safety, is the most fundamental for anything to be successful.
Fantastic. So the question again, to see, that was perfect. A step change in how seriously employers take eye health. Carlin, what do we need to do?
So one change I would think is communication. So communication is very important to bring in awareness, whether it's eye health, as well as awareness in terms of taking your health as important, you see. So I think that will help in terms of communicating to the management as well as to the individual employee.
Yeah, thank you, Colin. Anshu?
Change in communication from what to why. What is, go get an eye exam, to why do you need an eye exam? Yeah. I think that's important. The second thing of importance is that the government policy needs to be such that the enforcement is the responsibility of the employers, whether it's for their direct employees, and I want to expand the universe as well, because the world of work is more than just organized sector.
Yes.
Lots of people working in the unorganized sector, weavers, artisans, drivers. So then the onus from the organization should be to further push that compliance on their vendors, on their supply chain partners.
Yeah.
So then we're establishing a system where the government is the policy maker, but because governments around the world, at least in most developing countries, are not good at enforcement.
Yes.
They're very good at making policies. So they push the enforcement out to the...
Yeah, a different lever. Very interesting. Thank you very much. Shen.
Mine would be on connections, making sure that you map out your stakeholders and identify those who will be able to move and influence things on your behalf and connecting with them. And I have to say, I really appreciate the question on systems leadership, because as a public health person, we think at scale. We look at population level influence. And as my alma mater, Johns Hopkins, would say, we look at saving lives millions at a time. And I would encourage you to think at scale.
Yeah, think at scale. Thank you, Shen. Final word, Jamila. Thank you again for being with us this morning.
If I can just tell Shen that Johns Hopkins is now going to put a Planetary Health Institute, and everything in Johns Hopkins is now going to be fundamentally driven by planetary health, so it's fantastic.
Good.
I'm going to say two things. One is look at health equity, that everyone has the right to health, and that includes eye health, and it is affected by the many different challenges that we're facing in the world today. Yeah. I haven't talked about nutritional issues and eye health, because climate change is actually affecting the quality of nutrition of our food as well. So for that to happen, then it's not just is the multi-systems approach, but also partnership. I think we've got to come together on a common destiny that we want to make sure everyone has equal access to health, including eye health.
Fantastic. So thank you. But as well, thank you each and everyone, especially for your very personal and organizational examples of your excellence. We're grateful to that, for the work of Vision Spring in connecting very different organizations. Shen, for the leadership you're showing through the chamber, and of course, to Jamila, thank you for your leadership and your vision as well. We're hugely grateful to all of you. Thank you very much. Thank you. Well,